Hey guys, it's Marissa. I just wanted to do a quick update about my ultrasound today. So today's May 29th and I had my first ultrasound. There's the dog. Okay, good one. And so I had my first ultrasound and my first OB appointment. So I was at the doctor's office for about 2.5 hours today. I had my ultrasound, and then I went to the lab and got blood work, and then I got to see the doctor. And she did like a whole pelvic exam and all that fun stuff. So, but anyway, we have ultrasound pictures. And actually the baby was, like, its head was downward, so it was kind of upside down, but I'm going to show you the pictures right side up, because I think that makes more sense. Okay. So here's the first picture. It says BYBA because it's upside down, but it's baby. So here's the head and the body, little feet or leg, and there's the umbilical cord. And then I was a little worried about, like, why does it have a little spot there, but the ultrasound nurse or the ultrasound tech said that that was normal looking. And then next picture, here is, sorry if there's a glare, this is the baby. There's this head and this little body and his little arms and then legs, feet, I don't know, this is all kind of blobby down here, but you can see the arms and the head. Sorry about the glare. And, yeah, my grandma tried to say she could see the eyes and everything, but I think she was a little crazy. So, and then, and the ultrasound tech was like, oh, he looks like a gummy bear. Like, yeah, it does kind of look like a gummy bear. So, maybe we'll call it a gummy bear now. I don't know. And there's another picture. This one's not as good as the last one, but there's the head and the arms and the body, and I don't know what's up with the legs. I don't know if they're just not all the way developed, like they're little buds, or if they're like scrunched up, kind of. I'm not sure. She said it was arm and leg buds, so I guess it's not fully formed. But I was measuring right on track. I thought that today I was 8 weeks and 6 days, and I measured exactly 8 weeks and 6 days. And I really thought that my due date was going to change. I thought my due date was January 2nd, and I thought they would be like, oh, well, it's probably more like January 5th, 6th, something like that. But it's January 2nd, right on track. So that's pretty cool. Yeah, so tomorrow will be 9 weeks, and I'll do my 9-week update tomorrow. But I wanted to do the doctor's appointment update today. So then I had my blood drawn, which was awful, but anyway, they took like all my blood and the lady was awful. But then I saw the doctor, and she said everything looked great, the baby looked great, you know, everything's measuring right on track. The only thing that I guess was a little weird, the dog. Say hi, Elvis. Say hi. Oh, okay, lay down. She said, the doctor said that I had a small, I guess, ultrasound tech did it because they, you know, use the wand, lovely, and, she, you know, looked at my whole uterus and my ovaries and everything, and she said there's a small implantation bleed in my uterus, which I guess just where the, like, embryo implanted, there's a small, she said it's really tiny, she said it's nothing to worry about at all. The only thing is that your body, or my body, might naturally absorb it, or it could expel it, so I could have a little bit of spotting, and that would be the most likely reason if I did have any spotting, which I haven't had any spotting or cramping or anything. The dog's laying on me. So, you know, she said not to worry about it, that I guess she just wanted to let me know in case I did have any spotting, not to freak out, which I probably would freak out anyway, even though I know that I'm still going to freak out if I have spotting. But I haven't had any cramping or anything like that, so I'm not really worried, and the doctor wasn't worried about it. It was kind of like she said it in passing, like it wasn't even a big deal. So I'm not too worried about that. So I think we got a lot of good news today, and I'm super excited. It was so crazy to just see it. Like, I haven't believed that this, like, last 4 or 5 weeks that we've known, I still didn't believe it, and I still kind of don't believe it. I told myself I would believe it when, oh, you might be able to hear the train. The train's going by. But, I told myself I would believe it when I saw the ultrasound, but it's still kind of like, is this really inside me? I don't know. So I guess it is. But anyway, and then I was kind of just going to show you like what my doctor's office gave me. They gave me like a whole stack of stuff. They gave me a book, Your Pregnancy and Childbirth, month to month. So they gave me a book. They gave me several like pregnancy magazines, just that they probably get for free and give out to pregnant ladies. And this magazine is super cool. It's called As Your Baby Grows, From Conception to Birth, from the publishers of American Baby. And it's really cool because it shows you like month to month, like actual pictures, like from, oh, the glare's horrible today, but like actual pictures of like what the baby looks like in the uterus. So that's kind of cool, although some of the pictures are kind of creepy. But it's cool. So I got that, and then of course they gave me all of these all this paperwork that I have to call the insurance and ask them like sorry, how many days are covered for a hospital stay for a normal birth, and like all this crap that I have to fill out before my next appointment, which I'll be going every 4 weeks until 32 weeks. So I'll have an appointment every month, which is kind of cool. And she gave me like a big folder about the hospital and just stuff that the hospital offers, like prenatal massage and Lamaze classes and childbirthing classes and all CPR classes, all the stuff that the hospital offers that we can do, blah blah blah. So I got a whole bunch of that stuff, and then I got this. This is something that my husband and I have to discuss because I'm still not really sure what we're gonna do. But one of the things that we have to kind of figure out before my next appointment would be genetic testing. So she gave me this little pamphlet about sequential screen. So we have to figure out if we want, like, I guess they do, in the first trimester they do an ultrasound and blood work to screen for like birth defects, and then the second semester they just do more blood work. So I'm not sure if we're going to have that done or not. They said most insurances won't cover this, so I guess we would have to look in to see if our insurance covered it too. So just some things to think about, I guess. And yeah, so I don't know, that's about it, I guess. I don't know. I'm on information overload because I have so much information from the hospital, from the doctor's office, for insurance, for all the stuff that I have to figure out. So information overload, but glad that we got to see it, and we could see the heartbeat. I don't know if I said that, but yeah, we could see the heartbeat. We didn't get to hear it, which I was a little disappointed. She said, the ultrasound tech said that they can't hear it on their ultrasound machine. Like, the doctor would have to use a Doppler, and the doctor didn't do the Doppler because we'd already seen the heartbeat. But the heart was beating 174 beats a minute, so that's good, really good. So that was exciting. And yeah, I think that's about it, guys. Thanks for watching, and I'll be doing my 9-week update tomorrow because I have some baby buys and whatnot, symptoms I'll talk about. But anyway, thanks, guys. Oh, and a big shout out to a bunch of people who've gotten BFPs. I know, well, Ronnie from is she in vitro experiment? I don't know if that's her name. But anyway, you know, she had an ultrasound today and she got to see a heartbeat. And Mickey, I I can't remember her name either, her username, but she got to an ultrasound today and got to see the heartbeat, so that's really awesome. And Lisa Marie had her transfer today, so just lots of good things happening. So anyway, yeah, I'll talk to you guys later.